Hi, today we are looking at eating disorders. There is no chapter associated with this, so you're going to find this in a supplement in chapter 6, starting on page 166, where you'll see the information is derived from. So, page 166 in your text. So, when we're talking about eating disorders, we're going to talk about disordered eating and then the different types of eating disorders. Okay. So, when we're looking at food as more than just a source of nutrients, we've talked at length about food serving different psychological, social, and cultural purposes. It is linked to personal emotions. Many people use food for comfort, and we do have those happy chemicals that are released when we're looking at food intake. Disordered eating, as opposed to an eating disorder, is a mild short-term change in eating pattern. So it might be things like excluding a whole food group temporarily, eating only at specific times during the day, eating only foods of a certain color or food group, and not eating foods together because of the texture. Oftentimes it is very temporarily. So an actual eating disorder is a severe alteration in eating pattern, and the link is the psychological changes that occur with it. So disordered eating, probably all of us have experienced this at some point in time, and eating disorder, a clinical diagnosis. So overview, we're seeing about 5 million people in North America impacted by eating disorders. And when we look at the terminology, anorexia, you know that means decreased appetite, and nervosa, that means disgust with one body. So the definition would be psychological loss or denial of appetite followed by self-starvation. And in those things we see extreme weight loss, distorted body image, fear of weight gain. And this picture here I like to highlight because it shows this very thin woman on a scale, but when she sees herself in the mirror, she sees somebody who is overweight. So that distorted body image. Bulimia nervosa, on the other hand, the bulimia, that translates into ox-like hunger, and that is a binging and purging cycle. And people can use the purging in way of vomiting, laxative, diuretics, enemas, or this term hypergymnasia, which is just excessive exercise. It's a very secretive disease, and we'll talk more about the diagnoses. And then we have EDNOS, eating disorders not otherwise specified. And this is a binge eating disorder, but we don't see the purging that is with that. We just have the binge eating. And oftentimes there's an overlap and crossover among the disorders. So those of you that did the eating disorder case study, you saw that the patient in the case study mostly had anorexic tendencies, but we did see some bulimia nervosa tendencies. Right, so anorexia nervosa, unfortunately 3 to 10% of the cases result in death. There is a common relapse. But we'll see here the common themes: denial or loss of appetite, depression, lack of appropriate coping mechanisms, and intense fear of gaining weight. If you look on page 166, actually it starts on 168, diagnosis for anorexia, your book says significantly low body weight caused by persistent restriction, intense fear of gaining weight or becoming fat, and persistent behaviors that interfere with weight gain, and then finally, disturbance in self-perceived weight. This often occurs in adolescence, because we talked about, there's a lot of changes going on with puberty, intense pressure to look a certain way. There is a lack of control here. We see delayed sexual maturation and menstruation in women who suffer from anorexia nervosa. And then let's look too at a condition called diabulimia, which is diabetes and disordered eating. So teens